I'm Dr. David Miller, and I am the director of the Comprehensive Stroke Center at Mayo Clinic in Jacksonville, Florida. One of the biggest misconceptions about stroke is that it only happens to the elderly. While age is one of the biggest risk factors, anyone can have a stroke. According to the Centers for Disease Control, more than 795,000 people in the United States suffer a stroke annually. Although mortality rates for stroke have decreased, still, almost a quarter of stroke patients will die as a result of their stroke. The latest numbers on heart disease and stroke from the American Heart Association confirm that stroke remains a leading cause of permanent disability, including paralysis, speech difficulty, memory, and emotional problems. The cost of stroke nationally is significant. Some reports suggest that stroke costs the United States somewhere between $34 and $70 billion annually. That includes healthcare services, medications, and lost wages. There are a number of ways to reduce and even prevent stroke. The top things that you can do are stop smoking, control your blood pressure, and take your blood pressure medication if it's been prescribed for you. Lower your cholesterol, maintain a heart-healthy diet, and most importantly, exercise. It is important to know the signs and symptoms of stroke. It's really pretty easy. If someone has a sudden weakness or numbness in one or both sides of the body, if they suddenly lose vision, if they have a sudden inability to speak or to understand what you're saying to them, they may be having a stroke. A sudden weakness of the face, arm, or trouble walking, these are all signs of an acute stroke. Women are actually at a higher lifetime risk of stroke than men. Part of that is that women tend to live longer than men, and stroke is age-related. But together, women account for more than 60% of all stroke deaths. We tend not to think of stroke, or actually any heart problem, in younger people, especially younger women. But the truth is, young women are at risk for stroke, and young women have strokes. It's important to look at the person and look at the symptoms that you're seeing. Remember, if you're having sudden weakness, vision loss, difficulty speaking, these are symptoms of stroke. And they're symptoms of stroke in someone who's 21 as much as they are in someone who's 81. The most important thing to remember is if you think of it, it could be happening. It's very easy to pick up the phone and call 911. If you recognize that you or anyone around you is having a stroke, call 911 immediately. Stroke is truly a medical emergency. Time is very important. It's important to remember that the signs and symptoms of stroke can come and go, and oftentimes people will dismiss them. But the truth is, those symptoms can come back suddenly and more severely and permanently. So it's very important to recognize that if you think someone's had a sign or a symptom of stroke, then you should seek medical attention. If you get to me before you have a permanent deficit, very often we can make a difference. We can reverse the symptoms of stroke. Unfortunately, far too many people arrive at our facility out of the time window for us to apply many of the therapies that we have for stroke, and these people are left with permanent deficits. It's important to recognize that even though time is important, you shouldn't attempt to take a stroke patient to the hospital yourself. Call 911. There are a number of things that the professionals can do to stabilize a patient and even begin therapy in the field. Thanks to recent advances, we have new medicines and therapies to treat stroke and to reduce the risk of permanent damage or death from a stroke. From intravenous clot-busting medications to new minimally invasive surgical interventions, we're changing the landscape for patients with acute stroke. At Mayo Clinic's Comprehensive Stroke Center, we have a number of cutting-edge clinical trials for retrieving blockages and stopping hemorrhages. Stroke is a major health problem, but by being aware of the signs and symptoms of stroke and seeking treatment immediately, together we can make a big difference in these patients.